Usually use a varus needle. In this patient, I would not. I would probably either start with a little cut down at the umbilicus or cut down in the left upper quadrant.
Yeah. We've done several of these, and you can get in the left upper quadrant pretty readily, or even with a transverse abdominal incision in kids who've had stomas for neck or meconium ileus, you can get into the upper abdomen pretty easily.
Through an open incision?
Yeah,
right?
open, and then Hassan put a little 4 millimeter port in.
Yeah.
Oftentimes, if you reoperate on a gastroschisis baby at 6 months, there's not
We
very
did check gastric emptying, and we did pyloroplasties on these neurologically impaired, but when I switched to the laparoscopic Nissen, and then the statistics came out that it helps with gastric emptying, I don't do it any longer. I would qualify D to say in many or most patients it helps. There still is a segment, I think, that has poor gastric emptying.
So here's a question I have for the group. In kids you're doing a gastric pull-up on, do you do pyloromyotomy or pyloroplasty?
for gastric pull-up.
Interesting, we have about a quarter of the audience that's saying they'd fix all patients, even asymptomatic. I wonder if that's because they're worried of a peristaltic hernia, but I'd agree, unless they're symptomatic, you don't touch them. You know.
Yeah, I'm sure I have a hiatal hernia because I'm fine on medication.
You're walking around it.
Yeah. But,
okay.
well, actually, Mark, we recovered pretty well. Got back only about 15 minutes behind schedule, so we made up an hour.